I would say the ovary's involvement in PCOS, PMOS is more of a response to the other dysfunction going on. It's not, oh, your ovaries caused this. It's the ovaries are very dense with mitochondria. I
Yeah.
always say longevity and wellness is ovarian health. I mean, it is, it
Mm.
really is.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well-being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
Welcome back to the Integrative Medicine Podcast. My name is Amanda, and today we're discussing a major shift in women's health, the official renaming of PCOS to PMOS, Polyendocrine Metabolic Ovarian Syndrome. Experts say the new name better reflects the reality of this condition, which impacts far more than just the ovaries, including hormones, metabolism, inflammation, fertility, and overall health. To help break down what this change means for women and why it matters, we're joined by Emily Rodriguez, a nurse practitioner based in Madison with a focus on hormones and metabolic health. Let's dive in. Did you get a chance to look at the article that was published on it was in the Health Stat?
Yeah, yeah. Like I think they published it under health policy in the Lancet.
Okay.
And so, yeah, I actually did. I had a chance to glance through it yesterday, which it's interesting because it's, all of a sudden this pops up that they've been working on this for years and going through this and that it's been worked on by people from, multiple different countries, which is cool. But it was funny. The first thing I thought of when it came out was like, well, this is what functional medicine's been doing for a very long time.
Yeah.
It's, with many things, it's like, oh yeah, thanks for catching up, guys.
Yeah.
So, yeah.
Mhm.
And I know we see a lot of patients with PCOS. The current stats, they say 1 in 8 women have it in the United States. And I think that's probably similar worldwide.
Mm-hmm.
And it's, I would say it's funny because I have a lot of women come in and they're like, I think I have this. And
Mm-hmm.
nobody, it seems like they're almost like afraid to diagnose them. And the problem I think is that when females periods start when they're younger, with PCOS, they tend to have, really irregular cycles. And when it comes, it can be really heavy. And so step one treatment for them has always been birth control, usually the birth control pill. And so then they get put on the pill for several years. And then the real, root cause behind what was going on just kind of gets ignored until they get to an age where they're either, I want to get off this, or they're thinking about maybe starting a family. And then it's like, oh, let's stop it and see what happens.
And see what happens.
And I feel, and see what happens. And that's really what they get told. And a lot of times, the treatment is, and with PCOS, one of the hallmarks from a hormonal side is that a lot of them have low progesterone. And that can make it difficult to get pregnant. It can make it difficult to maintain a pregnancy. So PCOS women are at a higher risk of miscarriage. But, typical fertility support for them is, well, once you've had 2 miscarriages, we'll start diving a little deeper into what's going on. And I had a friend
go through that. I had a friend go through that just recently, and I don't know if she has PCOS or not, but she just went through, she was trying with her husband, and she lost their first baby. And she wanted to dig in because she knew something wasn't right. Like she had this gut feeling where it's like, no, I want to know more. And the provider that she was seeing was like, no, we have to wait until you have at least 2 miscarriages before we dig any further. That did not sit right with her. It didn't sit right with me. It shouldn't sit right if you want to explore more. But miscarriages today are just like, oh, well, they're so common. Everybody, that shouldn't be the conversation. It shouldn't.
No.
And she ended up going somewhere else. Well, she ended up having a second miscarriage, and she was like, okay, screw this. I'm going somewhere else. I know something isn't right. And they did, I think she may have had some cysts and stuff like that, but like the fact that she was dismissed right then and there because she had a traumatic event, but according to traditional medicine, according to the system, it wasn't traumatic enough. You have to have 2 or more traumatic events in order for us to dig a little bit deeper.
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting-edge therapies, we help you heal and perform your best. And now, Through shopforumhealth.com, you can access physician-grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
I never understood that. I just didn't. I'm like, when you're sitting in an office with someone in tears because they've had a miscarriage, it's like, I'm not going to tell them, "Oh, well, let's wait and see if it happens again." It's,
Oh,
let's get some lab work. I mean, I was doing that even in traditional medicine, like,
yeah.
let's check some labs. And if I had a patient that we knew had PCOS who was trying to get pregnant, I always told her, and I still tell even our clinic patients now, I'm like, if you get pregnant, let me know right away. Because if you're not on progesterone, a lot of times I will either start it while we wait for labs, or I'll say, come in right away. Let's check your progesterone level. Let's check that HCG quant. And if it's not good, let's start something ahead of time so that we can prevent the miscarriage maybe. And I know that
Yeah.
that's not how the guidelines are, but to me, that's what makes sense. And that's what, functional medicine is getting to that root of like, well, let's look deeper. Let's see, let's try to prevent things before they become a problem.
Right.
But yeah, PCOS, I know it's very misunderstood. I have patients who come in who are like, well, I've had an ovarian cyst. Do I have PCOS? And then I have patients who are like, well, they told me I didn't have it because my ovaries look normal. And so the name it change is, I think, just finally catching up. It's
Yeah.
not, polycystic ovarian, like not everyone with this condition has polycystic ovaries. And the whole concept of it being a cyst in there is actually misleading. Ovarian cysts can form for a variety of reasons, but when you see the polycystic kind of pattern on a ultrasound, what they also often call a string of pearls, a lot of times those are just follicles that didn't
Yeah.
fully develop. So it's
And that's another thing
again,
that I think that is misleading too. Like when you see all of those follicles, like sometimes they think, oh, you've got a lot of eggs. And that's
yeah,
good. But
no,
sometimes too many, like that is can also be a sign too. So PCOS is dead. Long live PMOS.
PMOS.
PCOS stood for Polycystic Ovarian Syndrome. Now the revised name stands for Polyendocrine Metabolic Ovarian Syndrome, now known as PMOS. This was revealed on Tuesday, May 12th, 2026, and it is just one letter change, but it is going to change so much. It's going to validate a lot of women. I think that it's also going to help clinicians diagnostically because I think having that term in their cyst also just created some confusion for diagnosis.
Yeah, completely. And I'm hoping this will help more women get help and get better treatment because we're acknowledging that it's more than a gynecologic issue. And that is, unfortunately, I mean, most women would go see like an OB-GYN for this. And it's really, like it said, that polyendocrine, it's a multiple endocrine system involved. There's insulin resistance in some of these patients. There's androgen excess, and it's not always just testosterone. A lot of times, testosterone levels on a lot of my patients with PCOS, when I've checked labs, actually doesn't look too bad. But
Mhm.
that DHEA sulfate can be high. Or it can be a problem with kind of downstream metabolism, which is why, in functional medicine, sometimes with these patients, a Dutch test can be really beneficial because it shows us that hormone metabolism down into the tissue level. Whereas, if they got told, well, they checked out my testosterone and they said it was fine. I don't have PCOS. I'm like, well, there's a whole complex pathway of those androgens going through your body. And that might not be the whole picture just looking at that serum test. So it's nice to have nice options, I would say, to kind of dive into this a little deeper. And it's going to, again, like everything, every woman's unique, every body's different. So some people have a gut health component to this that affects their hormone health. We know
Mhm.
the research on the microbiome is just fascinating, and we know the connections between microbiome and insulin sensitivity and diabetes risk, which is obviously an endocrine system as well that plays into effect with PMOS. So it's exciting to see that people are going to be talking about this more mainstream because a lot of these women struggle a lot. I mean, weight gain, fatigue, hair growth where you don't want it. And then, yeah, the fertility concern as well for a lot of them, which is very heartbreaking for people to deal with.
So, what when we look at the name Polyendocrine Metabolic Ovarian Syndrome, what a mouthful. That said, polyendocrine, you kind of said it, multiple endocrine. Can you break that down and what does that look like? Polyendocrine. If we were to take this PMOS apart, because now it's gotten closer to what this condition actually is.
Yeah, correct. Yeah. So that polyendocrine just means, multiple systems are involved, multiple hormone systems. And we, in functional medicine, we kind of have this hierarchy of our endocrine system with, cortisol being at the base. I always say cortisol is one of those most important hormones. We think of it in fight or flight stress, which, there's a lot of things that cause dysfunction in that system, but it does play a role in PCOS as well. And then, on top of that, we have our sex hormones. In PCOS, we really think about the androgens, excess testosterone, excess DHEA, which is causing, a lot of those kind of visible symptoms that people will see. If they have, facial hair growth, they can have hair loss on on their head on the top. And then we also know that these systems all can affect our thyroid, which is also an endocrine system and involved in hormone, the
So
hormone
stress
cycle. And then,
yeah. Okay, there's a fourth one?
yeah, nope. Yes. Oh, I was gonna talk about actually with the other hormones, like the sex hormones, progesterone plays an
Yeah.
important role because they tend to have issues with progesterone because in PMOS, a lot of times regular ovulation is not happening. And ovulation is the key event of a menstrual cycle that's going to allow your body to make, a good amount of progesterone. And so when you are not ovulating regularly, you can't make progesterone well. And that's what'll drive a lot of the dysfunction in irregular cycles. And then, sometimes when they do have a cycle, even if it's once a year or twice a year, they're having significant heavy bleeding that's disrupting their life. So these all have a very complex interplay with each other. And I would say nothing in the body is a silo. Every single system here that we just mentioned is
Yeah.
interrelated. They all affect each other. So it is cool that they're acknowledging this is a multi system problem.
Yeah.
And then that second letter, metabolic, obviously, that's what we think of, a lot of cases of PCOS, there's some level of insulin resistance. They have trouble with weight. They're at a higher risk of type 2 diabetes. We know all these things. And then I think there is a subset of population with PCOS that does not have insulin resistance. It sometimes gets called lean PCOS. And what I tend to see in
Oh.
those patients is a lot more of that kind of adrenal driven dysfunction from those adrenal glands with the issues with cortisol. But cortisol can cause a lot of the other downstream effects that we see in all forms of PMOS. So and then ovarian syndrome, it keeps that reproductive connection there. I always say the ovaries involvement in PCOS, PMOS is more of a response to the other dysfunction going on. It's not, oh, your ovaries caused this. It's the ovaries are very dense with mitochondria. I
Yeah.
always say longevity and wellness is ovarian health. I mean, it is, it
Mm.
really is. And I have seen actually in some of the discussion around this paper, they're actually talking about this a little bit with the men's health too, in that you can actually see patterns of this come from both sides of the family. Like male,
Mhm.
it could be passed down maternal and paternal. And, the ovaries and the testes developed from the same tissue. The things we see in men's health with, androgen issues and other things like that, it's very similar metabolic processes going on. So I think, we talk about the hormone crisis in this country. And yes, there's lots of external factors involved in this, endocrine disrupting chemicals in the environment. I think our use of plastics plays a role, artificial fragrances, all those things that are playing a role as well. But it's nice that we're finally going to talk about there are multiple things playing a role here and that we need to consider them as this kind of collection of syndromes, symptoms that we're seeing in these patients to hopefully get them some better answers.
Yeah. Actually, keeping the word ovary in there or ovarian in there was one of the like controversies because they are, like you said, seeing this in men. I don't think they made a mistake, but I think there's going to be another renaming of this. This journey getting us to
Hmm.
PMOS started back in October of 2015. So this was an 11-year cycle of renaming the syndrome. And there were a few voices out there who didn't agree of keeping ovary in there because there is more research coming out on considering men in this.
Hmm.
I like what they said in the article that, keeping ovary there for right now, we need to keep the focus on women. Women have been so dismissed and we haven't had the appropriate research done on women that if we just like make this, oh, it affects men and women. I do think men need a place. They need to understand this. I think doctors, clinicians have to understand that men can have this syndrome too. But I do agree keeping it with ovary, at least for now.
Yeah, no, totally. And I mean, this is, as a hormone health provider, especially looking at mostly, women's health, menopause, perimenopause, I know time and time again how much women have been dismissed, how many times they come into our office after seeing multiple different providers, just completely getting blown off. I don't know how many times people tell me that my doctor told me I'm just getting old. And it's like,
Mhm.
no, no, you're not
Yeah.
old. You're not old. Like, I had a 40-year-old whose doctor told her that. And it's like, you should not be feeling this way. And, it is the women, it's their turn. It's their turn
Yeah.
to get some help and to not be ignored. And yes, I love our men's health. I think that's important too. I think that when you're looking at the health of a country, we need healthy people. We need healthy
Yes.
families. We need healthy partnerships. Men's health and women's health, they all affect, we are all interconnected. We
Yeah.
definitely need to pay attention to that. But I think right now, we do know this does affect a lot of women. It does
Yeah.
affect a lot of women who have been ignored. So I think keeping the ovarian there is, I guess, if you were going to talk, maybe gonad. That is what the ovary and
Yeah.
the testes are. So it may be
Yeah.
polyendocrine metabolic gonadal syndrome,
Gonadal
but it's
for men. Yeah.
So, so yeah, maybe they can have their own name. So
Yeah,
yeah.
exactly. I like what you said, like, so PCOS had several limitations due to its name, providing an inaccurate description of the condition because it doesn't just manifest through cysts on ovaries. And this led to patients attributing ovarian cysts to PCOS and the risk of being underdiagnosed for other conditions. As a result, the Lancet published that while the condition is believed to affect up to 13% of reproductive age women, now you don't have to be reproductive age to have this either. Take that out, but this is believed to affected up to 13% of reproductive women, causing symptoms like weight gain, acne, irregular and painful periods, mental health. The World Organization estimates that 70% of people with the condition are undiagnosed.
I believe it. I believe it. I
We
mean,
see it every day.
I we see it every day. We see it every week. I see women who were the ones diagnosing it. And I talk to them about it, with any disease process. I'm like, you don't just wake up one day and like a switch flipped. This is usually a process over years. And
Yeah.
so when I have a woman in front of me who's telling me, well, I think I have this, but they told me I didn't. I always say, I mean, like, health is kind of on this gradient where it's like, if we do not intervene, every day things can get a little bit worse. This disease can progress a little bit more. So the traditional criteria used by most providers to diagnose PCOS, yes, has a set, like, you have to have this, that, you have to have 2 out of 3 criteria to meet it. And I always tell these women that, maybe you don't meet their perfect standard of this diagnosis
But
at
you're
this
on your
time,
way.
but you're on your way there. And why don't we stop it before it
It's
gets any
harder
worse?
to stop it when you can. So I have a
Yeah.
question. It's a slow
Yeah.
progress, but there are young women who are getting their periods. I was one of those kids too. I was never diagnosed with PCOS. I probably could have assumed I had it. I had very, very painful periods. And the solution was to go on birth control. So I no longer had painful periods. So I never explored further. How What would you tell somebody who is maybe younger, just getting their period? It's super painful. Was that progressing over time and then they just got their period, or what's going on in
Yeah.
that age?
Yeah. So one of the things that is really hard to study with health and medicine is what kind of the intergenerational health effects. So, what was my grandma exposed to?
Mhm.
What was my mom exposed to? What was my mom exposed to when she was pregnant with me? There was a study, I believe, around 2010 era that did chemical toxin testing on umbilical tissue, and they found, I think, over 200 different chemicals in
Oh,
the umbilical
I've heard
tissue. So,
997
yeah,
neurotoxins in
yes.
umbilical
So,
cords
yeah,
alone.
yes, there, depending on what sample, yeah, I think it was an average. So
Yeah.
we're exposed to a lot, a lot, a lot. And each generation, like, since then, has been exposed to a lot more. So you know what? Even with hormone health in general, women, I'll have
Yeah.
women come in and be like, my grandma was fine. My great grandma was fine. Why do I need this? And I'm like, well, we live in a different world than they did. We're eating more processed foods. We're exposed to a lot more chemicals that didn't even exist in their world. We we're inside a lot more. We don't grow our own food. We're not working physically the way people did. A lot of us are at, fairly sedentary jobs inside on computers. I mean, all of that is a very rapid change in when you look at the history of human evolution and what has, affected health. And when we see, an average period go from like 14 to 12, 11 in a very short period of time, that's environment. That's not
Yeah.
genetic mutations. That's environment
We just
driving
we
that.
just watched the Netflix documentary, The Plastic Detox, and they talked about the generational impact of
Yeah.
what you do today follows your family lineage for at
Yep.
least 3 generations.
At
So,
least,
what
yeah.
my grandma was exposed to, like you said, what my grandma, what my mom, probably what my great grandma was exposed to, that's all something that came into me.
Yeah, absolutely.
Okay.
And I am loving that I'm seeing more younger women in the clinic. I see a lot of their moms for perimenopause, menopause stuff, and we get talking, and what mom isn't going to say, I'm concerned about my daughter. Her periods are terrible. I don't want her in birth control right now. I've read about the risks. She doesn't really need it right now. She's not trying to prevent
We're getting
pregnancy.
more and more
So,
educated people, and it is
yes, it's awesome.
fantastic.
It's awesome. And the thing is
It's
too,
so great.
with a girl starting her period at age 8, 9, I mean, what I was seeing in clinical practice is by age 14, some of these girls were coming in not only on a pill for a few years, but they would be on Prozac and other depression and anxiety meds because we know that the pill increases the risk of
Yeah.
depression and anxiety. So it was starting them on this cascade of dependence on these meds that are very hard to get off of. And so I would tell young women, like, your period should not be scary. It should not be causing you suffering. It is a part of your biology, and we call it the fifth vital sign. It's a very important indicator that there's something going wrong in your health. And it's not always something you did wrong. But what I always talk to my young patients about is, how are you eating? How does our nutrition and what nutrients we're getting affects our ability to ovulate well and to have good progesterone production. How are you sleeping? Are you laying on your phone at night and scrolling TikTok? Like that's a common thing. It's part of,
Yeah.
their society and their world and their social network. And so, we talk about the effect of sleep on our cortisol and how that affects our other hormones. I talked to them about, what are they involved in? What are they doing with their day-to-day life? Are they feeling really burnt out? I'm like, if you're 16 and you feel like you have no time to yourself and you're running from one thing to the next, I mean, I sometimes tell them, like, you know what? Let's think about something we can maybe cut out and slow down a
Yeah.
little bit so that you feel like you have some time to
We don't
rest.
need to stress
Um,
out that early. Like, we get
no,
enough
no.
stress.
Yeah.
We have
No,
enough
and
to deal with when we are independent and go out on our own.
yeah.
We don't
Yep,
need to start the
absolutely.
stress. We don't have to start that stress cycle that early.
Yes, completely. And it's there are a lot of societal things going on right now, I think, for teenagers and even
Yeah.
preteens, middle school, especially with technology and trends and food, and that I think is
Yeah.
so damaging to health and our hormone health. So I think that it is important to have these conversations and let people know, like, yes, it's okay to step back. Let's slow down for meals. Let's make sure we're not skipping meals. I see a lot of
Oh,
teenage girls
yeah.
that they don't have breakfast. They stop at Starbucks and have like a
Right.
pretty sugary drink in the morning, which is one
There's
of the
the
worst
new
things we could
pink and
probably do
purple
for
one.
our
I mean,
hormones.
they're making these drinks
Yeah.
so that, like,
Oh, yes. Yes,
for sure.
totally. I mean, the marketing on
Guava
that is
meets
crazy, so
passion fruit. Cool.
yeah. Yep, so
Put that
yeah,
sparkly
so I
dust in
think
my drink. Oh, God.
yeah, but I mean, the hormone health starts early, and, I think it's a good thing to talk about. I always say one of the good things about the internet is it gets data into people's
Information.
hands,
Yeah.
information to them, and it lets people share experiences and talk about, "Hey, I didn't go on birth control. Here's some things I worked on." There's some great books out there. I mean,
Yeah.
Dr. Jolene Brighton was one of the early ones. When she wrote her book Beyond the Pill, talking about hormone health more in depth for women, and you have other options besides a pill, which is not how we're trained in traditional medicine. It's
Right.
very heavily focused on, here are the different birth controls, here's different options, and then it was kind of like, oh, you have a bad period, here's a pill. Oh, that didn't work, let's try a different one, now we can try this. So and I always say, if someone chooses that, it should be a truly informed consent of knowing, here are the risks. If you go on a birth control pill during your teenage years, you're at a higher risk of osteoporosis later in life because we're disrupting your estrogen and progesterone during a critical period of bone formation. These are things we know, but that doesn't get talked about in these doctor's offices a lot of times.
Yeah.
And a lot of it is just the way the system is set up. You don't have a lot of time with your patients and you don't get a lot of time to go into this stuff. So there's so many areas that need to be improved for health in general, but especially in women's health.
Right.
But I think that this hopefully will give some more guidance where we're going to start thinking about this in more of that metabolic
Yeah.
way of, you know, how do these systems come into, that complex interplay? Most people don't think about their sleep affecting their menstrual cycle, but it
Or
does.
their blood sugar.
Or their blood sugar. Yeah, absolutely. Blood sugar doesn't get paid attention to at all. But now I think, gosh, in recent years, what did they say? About a third of preteens are pre-diabetic.
Yeah.
I mean, we should be scared of that.
And you guys, we've got type 1, type 2, we've got the new type
Yeah.
1.5.
Yeah.
Like,
Yes. Yeah. And I mean, this metabolic health is it's foundational to
it
everything
is.
in our body. Everything. Our hormone health, our, cancer risk. It's driving a lot of dysfunction in so many different ways. So I'm hoping this will maybe be a big shift for us, especially in women's health, to start looking deeper and talking to people about these systems and getting them, some extra support of how can I tweak things with how I'm eating. Sometimes I'm just telling people on that first visit, I want you to start eating breakfast and I want you to start drinking more water. I
Yeah.
mean,
It
that's
doesn't
not
have to,
it
it
sound
doesn't have
it
to
doesn't
be.
have to be crazy. It's building sustainable changes. And then, as far as approaching this, PMOS, PCOS, we always in functional medicine, I'm like, we test a lot of labs. We check a lot of labs, things that never get checked. So it's diving in and looking at, you might not have high testosterone, but you might still have this condition. So we're looking at your fasting insulin. We're going to calculate your home IR. We're going to look at those metabolic markers that we know are going to tell us early on, is there dysfunction going on? I'm not just going to check your A1C. We're not going to we're going to try to catch
This
things a
isn't
lot earlier.
this isn't, and this is a complex syndrome, right?
Yes.
Polyendocrine metabolic ovarian. You've got your
Yeah.
reproductive, you've got metabolic health, and you've got at least you've got your stress
Hmm.
hormones, your sex hormones, and you've got your thyroid hormones. Like, there is a lot of complexity to this, and you should take it seriously. It's going to take some testing to understand what aspects are affecting you, but you want to do
Yeah,
that.
absolutely. No, I think for, a patient coming in, especially into a functional setting, yeah, we're going to be looking at blood sugar markers in depth. We're going to be looking at some inflammation markers. We're going to be looking at your sex hormones. And yes, we can check them. If you are cycling, yes, we time them around the cycle, but if we're not cycling, we will still look at them and talk about, well, here's what I see in your lab work. This is probably what's going on with why you aren't getting a period. It's then diving even deeper into, well, what is causing this? If, I've had patients who fit a very classic PCOS picture. I think of one patient in particular. She hadn't had a period in almost 2 years when I saw
Ugh,
her, and she would have fit like that lean PCOS picture. And when I actually dove into her labs, the initial blood work didn't look too bad, actually. Well, she ended up having significant mold illness. She lived in a moldy dorm her sophomore year of college. And when we started doing some mold detox and supporting her body's liver and gut, her period came back, and it came back every month. Her hormones regulated. So I always say there are studies looking at the chemicals in plastic and causing
yeah.
insulin resistance. So,
Yep.
taking a look at like what are those environmental exposures and how do we support our body's ability to detox? I always say the body's amazing. Yes, we live in this environment with a lot of things we can't control, but we can control what we put on our skin, what we put in our mouth, how we sleep, how we move our body. There's a lot of things we can control. And food is medicine.
Yeah.
I just read a really cool study out of, I think it was an engineering journal. I'll have to find you the link. They were looking at a probiotic strain out of kimchi, and they believe it can bind nanoplastics in the gut and help us detox. So,
Ooh,
I mean,
fun.
there's really cool studies on modified citrus pectin and detox, and
Yeah.
even oat beta glucan and detoxing PFAS, the forever chemicals. So,
Yeah.
food is so powerful, and our bodies are pretty incredible when we give it a little bit of love and support to
Yeah.
just kind of help clean things out.
It wants to heal. Your body wants to
Yeah,
heal.
absolutely.
Take away the stressors and give it what it needs, and the body wants to heal. But you have to
Mhm.
identify your stressors. You have to identify what you need to give your body.
Yeah, absolutely. And I think functional medicine, like I said, a lot of this is the model and the framework we use. You can't talk about this without considering your gut. The gut,
Mhm.
is so key to every system in our body and health. And I love stool testing when I have women coming in with hormonal issues, especially PCOS. I love looking at a functional gut test on them because it gives us so much information. And sometimes seeing those results is really motivating for people to make some good changes
Yeah.
with diet, maybe some targeted supplementation for a while. I usually say with gut, nothing's forever. I would love you to just be healing with food and sleep and lifestyle changes and stuff. But we will use some supplements when we need to kind of get things turned around. But it's that's a lifelong process of nourishing our
Yeah.
body too.
And right now, if you don't have access to the food, the nutrients, like supplementation it's important until you understand how to cook, until you understand what kind of
Yeah.
foods you need to introduce into your
Yep.
diet. They're temporary solutions while you're getting your foundation underneath you, while you understand what you need to put into your body. This
Yeah. Yeah.
was
I love it.
I know. This was such an excellent conversation. Such good timing. PMOS. We now have a new acronym. Emily, if somebody was out there listening to this, they felt dismissed before, what would you tell them?
I would tell them, number one, you have a right to get some answers. You have a right to be heard. You have a right to get some good care. I mean, come see us, come find somebody. There's functional medicine providers all over the country, whether it's Forum or another practitioner. I mean, there are some great providers out there, both in, coming out of kind of mainstream medicine like I did and naturopathic providers. There are some awesome new dietitians and nutritionists talking about this that can get you started on a really good path of just nourishing your body well to support your hormone health. There's so many people out there looking to help. And, if you're not in a position where you can seek out this care, because I know it's outside of the insurance model, there are some awesome books. Like I said,
Yeah.
Dr. Jolene Brighton, Beyond the Pill, Aviva Ram, she's written some great books about hormone health. Laura Bryden, she's a naturopath out of Australia, I believe. She had a book a long time ago called The Period Repair Manual. Like, there are some awesome resources that you could get from a library and just start reading and educating
Yeah.
yourself. You can make a lot of changes on your own to help your body. And then if you are feeling like feel like I'm not feeling as good as I could, I'm hitting a roadblock, I want to get some labs, come see us. Like, come
Yeah.
see us and we'll check the labs. We'll check the
Yeah.
labs.
Get started on your own. Start feeling better. And when you hit that plateau, there's people here to help you.
Yeah, absolutely.
Good. Well, thank you so much. This was such an informative conversation. I know there's tons of takeaways in here. If you liked this episode, if you found this helpful, share, like, and send to a friend who needs to hear this. You can find us at forumhealth.com and get signed up with a provider today. And we will see you next week. Thank you so much for joining us, Emily. It was a great conversation.
You're welcome. Thanks, Amanda.
No problem.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.